You ever wonder why, when you schedule a doctor's appointment, you go to it and then after the fact, you don't feel any better? In fact, you feel quite worse. And in this video, I'm going to explain to you why that is and what are some ways we can get through that and how we can change it. Because honestly, when it comes to dealing with issues with the ear is very complex, as many of you have already discovered. It's not as simple as just taking an allergy pill and then going about our life. It's a lot more complicated than that. When you're dealing with eustachian tube dysfunction, tinnitus, and TMJ, always indicate these three scenarios, these three things that we deal with the most, because these all have and play a part in why we have what we have. And so in today's video, I'm going to explain to you why you go to that professional. This is someone that has years of expertise and training in order to heal us from what we're dealing with. This is supposed to be the answer to some of the questions we have. Should be the end resort of what we're dealing with. And I'm going to tell you that a lot of times it's not. It's the exact opposite. And some of you are probably watching this video and you're probably thinking, what is this guy talking about? I know he's not about to say he has all the answers over a doctor. Well, I might not be as educationally trained in the medical aspect of trying to heal others when it comes to the conditions of the ear that we all very well know about. But I will tell you, when it comes to dealing with the mental side of things, I have a lot of expertise when it comes to that, and not just being in the situation myself, but seeing many others and dealing with many others and coaching many others in this regard. And I'm going to tell you that when it comes to dealing with ear problems, there's a lot of data, there's a lot of reference when it comes to popping the ears, clearing the sinuses, draining the ears. We all have heard all of that. But what about the mental aspect side? What about the mental health part of it? You don't hear a lot about that. In fact, you hear very little, if not none, of that regard when it comes to dealing with mental health issues with eustachian tube dysfunction. Now, I'm going to get into right now of the topic of this video when it comes to going to see someone in particular related to your conditions with ETD. Well, you schedule that appointment. Let's just say right now, I'm going to try to map out a little bit of what everybody's going through. You've had this condition. It's been going on. Depending on the type of individual you are, you could have maybe let a couple of weeks go by, maybe. So I will say there's two types of individuals. There's those individuals that get something funky going on in their body and they immediately try to figure it out and call someone right away and get on it. And then you have those others that are more like, I'm going to try to figure this thing out. I'm going to wait it out a little bit. So regardless of where you stay in those two examples, where you stand in those two examples, it's irrelevant, but I wanted to bring it to the light here. So you call this professional, regardless of what side you're on, and you have this inner hope of getting rid of this condition. You have this like anticipation, like it's about to be over. It's about to be over. Regardless if you're the one that jumps on it or the one that kind of lets it linger a little bit, you're going to still develop this sense of, okay, there is an end. Hopefully there's an end to this. And so being that it's what it is, the ear issue, you also associate is it not being something prolonged. So we're talking like a non-disease related, issue. So we're dealing with something that in our minds can be rid of pretty quickly. Well, this is what I thought. I thought that it being an ear problem, something to this regard, I could go see someone and it'd be over with. Maybe I was a little bit more patient back then, but I thought this would be over in maybe 3 to 4 days. Okay. Cause now I have a professional in place here. Now I have a professional in mind and I'm going to go see. This should be done in 3 or 4 days. Well, so you build up all this false hope, or this inaccurate hope, and then you go and see this professional, and it's almost like you went in. Of course, you're still oblivious to what it is. Really, you go in to see the professional, and it's almost like the end result. You're more scatterbrained than when you went in, and the reason why you are more scatterbrained is because you went in with not really thinking it was much, but now it's like, okay, here's some medication. This is what it is. It's probably just allergies. It's probably just something basic. No big deal. So you leave and you start going in that direction. You start going the allergy route, the medication route, and you start treating it as if it's a sinus related problem. And so the mental side of things hasn't been discussed at all. It hasn't even been talked about at all. So you leave, you start doing that. So you go to your day job, you do your normal, go to school, whatever it is you're doing, and you start going that route. Well, what happens is, and I will say 8 out of 10 times, which is pretty high to me, is that after about a week or two, you're gonna, or maybe three, depending on who you are and how you handle things and how much you're aware of this or how much it's bothering you. You're going to realize that it's not doing anything for you. It's not doing much for you. So then after you go to 2 to 3 weeks, maybe less, you start to develop a sense of panic because you're like, okay, I seen the provider, which is in your mind like the resolution. So like if you have a leaky faucet in your house, you call a plumber or someone, they come and fix it. You feel like, okay, step one, step two, that's all I need to do. Well, it's a lot more complicated than just making a phone call or visiting someone, unfortunately. It's a lot more detailed than that. And this is what I had no idea about. So after I'm doing the allergy thing, I'm going on about my business, I realized it's actually getting worse. And so I'm really started at this point. This is when the mental health decline starts to happen. Is when you've seen someone now. You've already visited someone and you realize that you're feeling worse. So then you start to develop a panic because your golden ticket to healing, the golden ticket, the access of where you need to go, the person you need to see in your mind, where you need to go, you've done that. So you start to think, okay, this is a little scary now. Who else do I go to? Who do I escalate it to? Basically, it's what you probably feel. And then if you were like me, you got a second, third opinion, and then it just got worse every time you went to those doctor's offices. It got worse. Hopefully you are going to see this video before you get to this position. But what made mine worse when I went and visited the doctor is the more providers I saw for the same issue, the more panic I became. I'll say that again. As you see more providers for the same issue and the same results keep happening, and you're not finding relief, you're going to panic even more because now you're like, okay, I've seen 4 people for the same problem. It's not going away. It's getting worse. You start to panic even more. You panic so much that you then have a panic attack. And this is when your body has completely lost control, completely lost the sight of everything in this point. Once you get to that extreme level, it is going to be extremely difficult to revive yourself back without some help. It's going to be a little challenging. I'm not going to say it's impossible, but it's going to be real challenging to be able to. And I have to say, I try to get as much help as I could with family and friends and things like that. But at the end of the day, it was a roller coaster because you've already seen the professional. It's like if you encounter a burglary or you encounter some kind of criminal activity, you're gonna call the police, and if they come and say I can't help you, you're gonna be like, whoa, what do I do now? So this is one of the reasons why I think when you go to the doctor's office, if that doctor isn't touching on the mental health side of things, you're going to feel this way. You're going to feel panic afterwards. Maybe not immediately afterwards, but when a week goes by or a couple of weeks go by, you're going to start getting more into depending on how the provider treats it with you. I haven't seen many situations or cases where you left that particular visit for ETD and it was treated with an allergy method. So basically meaning decongestants, put you on some of them nasal spray, a lot of nasal spray. In fact, some of the offices, they just hand it out by the dozens because they don't even really probably even need it anyways. It's these little sample sizes. They give you boxes of it. And so I remember just taking that thinking they were so kind and generous, which they were, but you take this stuff and you're thinking you're putting a dent on the agony you're going through, and you're actually just opening up more problems, more reasons to feel bad. And this is why I devote a lot of my time on this channel, is because I don't know another person like myself, and this is not the flex or anything like that, but I don't know another person like myself or organization that is is taking the issues of the ear and turning into a mental health awareness, because we all know mental health is a big deal in our world. It's climbing by, it's, by the day, it's going up and going up and going up. But what we don't hear about is someone taking, not understanding that your ears are tied. The vestibular system is tied to a lot of what we feel. So if your vestibular system's off, which is a system that controls balance, if your balance is off, your mood's going to be off. Your activity and productivity levels are going to be off. Your whole awareness is going to be off. And in return, your mood's going to take a hit. You're going to start feeling worse, depending on what you're doing. And if you work at a job that's stressful already as it is, you're going to be the first one to wave the white flag faster than someone else in the same environment you're in, simply because your vestibular system, the ear's natural production, the electricity in the ear, the circuitry is all off and thrown out of whack, and everything's going haywire. You're going to feel it probably way worse than someone else that's in your field, or someone doing what you're doing, a coworker or something. So where you work and what you do is a huge, huge factor of trying to get through the mental side of ETD. Reason being, again, just what I've stated, it's especially if you're taking medication thinking it's helping you. I know some of you may be on antibiotics. Some of you may be on steroids, like your nasal steroids. Some of you are on types of medication that can really enhance the side effects of what you do. So basically, if you're on these types of medication, it can really drive up blood pressure. It can drive up just your natural immunity, So if you're on these medications and you're doing this thinking, okay, I'm hammering this issue out, I'm hammering it out, you don't realize that you're doing these things and it's not really treating the problem. It's like water. It's like turning the water hose on and watering the cement. I mean, just watering it. Like literally, you have all this grass over here and you have cement over here, and you're just holding the hose on this side and just watering the cement. So it's one of those things where you want to bring all of that healing and positive forces to the right area. You want to put it into the right perspective. So that way you can start finding the healing that you need in order to get through this condition. And that's the ultimate goal. And so that is the main goal, and really the only way to find healing. So when you're going to these offices and you're going to the visits, you have to try to do your best to go with the idea of knowing that my mental health is fine generally, but what I'm dealing with does have a very negative chance that whatever it is I'm facing in my ear can provoke that. Because see, here's the thing: you don't want to be blinded like I was. I had no idea that this condition could provoke all these mental health related symptoms, like the panic attack, the anxiety to just go somewhere basic, a grocery store, drive down the street, go 30 miles away, and just feel like, should I even be leaving my close quarters? These are the things that it will do to you. But see, no one talks about it. No one talks about how when you have this condition, it's going to take simple tasks and it's going to make you overthink simple things. And this is why I really want to keep bringing awareness to it, because again, it's not really discussed as much, and it should be. And so that's really important that all of you hear this clearly too. It's extremely important. So as long as you go to the visits, you want to always make sure to get your good bill of health, but you want to go with the prep of, okay, breathe. I'm okay. I have a little anxiety. I have a little bit of pressure in my life, but a lot of it is related to this. If you can do that, if you can just put the two and two together and say, I'm okay normally. I'm okay in a normal aspect, but right now I'm dealing with something that's because of this. Most of the time it's because of that. If you can do that, you can go without going and get your feelings hurt, because you're going to go and get your feelings hurt because you're going to come out thinking that you're supposed to feel you're not going to think you're going to feel healed leaving, but you're going to think that you have the right tools in order to fix the problem. And when you realize you might not have all the right tools, that's when the anxiety goes up. So I'm not saying that you go to the visits thinking you're going to be healed the minute you walk back out, but you're going to think that you've got what you need to go heal. And so you need to be given the right things, though. You can't give someone instructions to how to assemble something that you don't have. And so that is the biggest problem, is that we're given instructions, great, but we're not given instructions to what we're assembling. And what we're trying to assemble is good health and how to heal this condition. We're not given the right instructions, we can't heal properly. We might find our way, we might scratch and claw our way there, but it's going to be a long, painful process like mine was. 3 years of clawing and scraping, emergency room this. I could probably tell you every emergency room layout of every emergency room I've ever been to, urgent care I've been to. I could probably name some people in each facility and tell you what they usually do, what they do, just for how long I've been there, And so I want to make sure a lot of you out there know that if you weren't generally dealing with anything bad, like if you already have anxiety, because unfortunately it's how you carry it and how you've been carrying it, unfortunately at this time, and then you have this condition, I'm not addressing that. I'm addressing those that didn't have much at all, didn't really have any issues like that, and all of a sudden, boom, you have them now. Those are the people in this sense that I'm talking to, because there's no way you're just gonna in the next month just be a person that falls apart over little things, unless you were that person for many, many years and now you're trying to figure out how to get better with that. I'm not talking about that. I'm talking about I was generally an easygoing, only anxiety when it was real, real bad. I'm talking the fastest roller coaster, stuff like that, job interview, things that most people get a little jittery over. I'm not talking about going to a grocery store and getting jittery. That's just, I almost said that was weird, but I don't want to be insensitive, but it was a little odd. I say it's a little odd. That's what I was doing, pushing the cart around, sweating and just wondering what's going on. So this video is for all of you out there that have doctor's visits scheduled, or planning to go, or already had a doctor visit done and completed, and you're still wondering why you feel like garbage. Basically, it's because of a lot of what I said. Treating it the way it needs to be treated. You need to, some of you might ask, well, what can I do? You didn't really name a lot of what could I do to fix that. Some of the things you can do is being mindful, being aware that the circumstances that you're facing are most likely triggered by this. So don't go wandering around, getting yourself all panicked. You know what it is, and now it's just really hammering out some of the resources around you, primarily things you already know, but need to develop them in a more consistent basis. So like you need to stay on top of your general health. I always say general, elementary health. Basically, you need to keep hydrating. Don't lose that. Please don't lose that. That's number one. Number two, you need to incorporate good, healthy, leafy greens. And number three, get your sleep. So these are important general things to do. This is going to help develop a better filtration system, a better defense mechanism in order to fight what you're feeling. Because the better you equip the basics, think of it this way: if you spend a lot of time, you own a company, you spend a lot of time training and enforcing a good bottom ground. So basically, those out there in the front, if you can equip them with the best of the best, all the good healthy resources, you're only going to make the top and the closest to wherever you are even better, because it has to start somewhere. So if you can develop the outer skirts of things, it's going to help the internal skirts of things. The internal well-being of yourself always starts from doing the basic principles around that. That's going to help everything else just put together. If you just say, hey, it's not big enough, not fast enough, I need something to take that's going to knock this thing out, it's going to be very hard to find that, if not impossible to find. So you want to structure the basics of things. So, develop the core of things. So that is going to be really helpful of it. Strengthen the mind, reading, doing things to just make yourself feel better. Those are all things that are going to not only improve who you are generally, but it's just going to help the overall situation of things. So I hope this video was very helpful for you. If it was, please take time to subscribe to the channel. I try to bring content as often as possible. But in the meantime, I'm going to step out of the J Wellness studio and leave you in good hands with this video. Like anything else, folks, we're here to simply go back to the basics. Take care of it, everybody.